The most pressing public health crisis of our generation is silent, and it's everywhere. It's a mental health epidemic. According to the World Health Organization, more than 1 in 8 adults reports having a mental health condition. So we know this is a widespread issue. We know this is an everybody issue. We're more connected now than ever, and yet we're also more disconnected. This is an era of extreme distress, a time when people of all ages are experiencing widespread loneliness and isolation, and citing these as causes for depression and anxiety. Mental Health America was founded in the early 20th century. We were founded by a young man who himself had lived experience of being in an asylum and experiencing the inhumane treatment of asylums at the time. As he made a very strong recovery, he became determined to start a social reform movement to change the practices, policies, and beliefs of the day so that no one would have to suffer as he did and anyone could recover as he had. And as a symbol of the progress that we have made during that time, we amassed those metal shackles that used to bind people in beds and had them made into a 300-pound bell of hope, which is our proudest symbol. Mental Health America is built on a national network of nearly 150 affiliates from across the country. Our affiliates provide direct services to meet the unique needs of their communities and ensure access to mental health care and other critical resources.
When you don't provide easy ways for people to be able to regulate themselves, like housing, which I do think is an easy thing we can do, or insurance, we are asking a lot of folks to be able to find the time to be able to take care of themselves. So the United States is unique because we have the financial infrastructure, but we don't use it in a way that's effectively meeting everybody's needs. As social workers, we have a picture that we rely on, and to describe what the picture is an actual figurine of a human. And there's multiple spheres that go around that person. And what we say is each layer of those circles represents an environmental influence on that person's ability to thrive. The closest being what is in close proximity to you. So that may be your house, like what kind of dwelling you live in, what kind of resources you have in your home, how much or how little can you provide for yourself, what does your access to food and shower and hygiene look like for you. And then when you move further out, it includes things like access to an education, a job environment, friends, a social network. And on the last layers, it's the institutional stuff, like the spheres of influence, like policies and laws that impact your access to healthcare and your access to be who you want to be. We have to think about all layers of those, from the individual micro surrounding the person all the way to the macro surrounding that person. And it's important to think about how they're all connected to each other. So going back to my role as a social worker, I'm always thinking about the individual as it relates to a macro policy that might influence that person's ability to access healthcare.
A public mental health approach means that mental health is a shared responsibility. It doesn't just mean to provide services for those in crisis. It means to work on prevention and promotion to make sure that we have mental well-being. So inclusivity is also a global issue. We need to make sure that we have the right resources and the right multilingual workforce in order for us to be able to help everyone that needs our support. So embedding inclusivity in an upstream strategy requires a cultural responsive program that includes linguistic ability and the resources for people from diverse communities. Instead of waiting for people to experience crisis, we should be focusing on early intervention. For example, if we go to school systems and be able to teach children how to manage emotions, will keep us from having crisis in the later years, because then they'll have some resources and some tools in order to manage their mental health.
So at Mental Health America, we've talked to our affiliates, we've talked to the folks that they've served, we've talked to our young leaders, we've talked to people with lived experience, and we know that they want us to be exploring spirituality and their mental health. And so at MHA, we have a Spirit in Mind initiative where we're exploring the connection, connectivity with community, with sense of purpose and service. And we're doing that across our portfolio and bringing in voices of lived experience, as well as people who are in various aspects, I think, of spirituality. So whether that's organized religion or people that have personal spiritual practices, we can each find our own way to a spiritual practice. And we think that at Mental Health America, we want to make sure that our community, right, is able to engage in that as in the pursuit of full person health.
One of the biggest misconceptions that young people today have about mental health is that they have to heal alone. I think it speaks to some of the lingering stigma, but I think it's more about the misunderstanding and the more individualistic push that has been had that you need to kind of disappear and heal alone and come back when you're ready. But healing is a journey. It's not a destination. Mental Health America's youth leadership program gives young mental health advocates an opportunity to be in community and learn together, a chance to understand insights about the space in a deeper way, and a structured support to enable them from going from an early stage program to a more developed program. One example is last year we hosted the first ever youth-led social media and mental health summit. We gathered everyone to convene and think about what are the ways that we can make sure that young people are safeguarded and have a social media experience that's healthy and supports them with their growth.
Youth leadership is about change. It starts with personal experience, after which it demands that we go beyond advocacy to create the systems and the structures which will truly support whole person health in the future.
When we talk about a mental health system, we're really talking about the various ways that mental health services are delivered and paid for. Current system of mental health care is in need of reform. We get calls every day of families who are struggling to navigate this system. It clearly is not working for the people who need access the way it is structured right now. And that's why we need advocacy and change to make sure that people have access and that it gets paid for. Parity is really paying for services equally to physical health. So when we reimburse for services, it should be the same for your brain as it is for the rest of your physical health. Until we prioritize those reimbursements, we're not going to see providers entering this field. We're not going to see a workforce that is staffed. And we also know that people are going to struggle with out-of-network providers. So we've really got to concentrate on making sure that parity is enforced and that it's available for all people who seek care.
I really look forward to the day when everyone has the opportunity to achieve their own optimal mental health and well-being. We all have lived experience. None of us have to look very far in our own personal histories or in the web of people that we know and love and care about to know that we are all affected. Here's how you can be part of the solution. First, take care of you. Reach out to a friend. Seek out connection with others. Make sure you have safety and support. Then, get informed. Share information. Take a free anonymous mental health screen on our website. Get active in your community. Join the movement at mhanational.org.